This is something actually which is coming up in the West quite a lot. In fact, you have CES or certified exercise specialists in US. Integrative medicine is where you actually look at not just the physical needs of the patient, but the holistic needs of the patient. It includes the spiritual needs, I think, like I said, the West is moving towards the East. So you have interventions which are Ayurveda based, which are based on yoga, on Pilates, calmness and meditation. And like I said, there are a lot of clinical trials being done in various cancers, where once patients have completed treatment, they are being randomized. That means the computer decides that half the patients will be treated through the integrative medicine approach and half the patients would be treated through standard approaches that we have today. So I think integrative medicine incorporates the holistic needs of the patient as well. So recurrence means when the cancer comes back after having been treated. So a cancer, when it is treated, it's treated with a curative intent. That means when we treat the patient, we treat so that the cancer is completely gone from the body. Or in patients who have advanced cancers, we treat with an aim to make the cancer go into remission. That means the cancer doesn't go away completely, but is dormant. And so the recurrence can happen in both scenarios. And the way we pick up recurrences is when we follow up the patients. So we usually follow up the patients at 3 to 6 monthly intervals, and sometimes annually once a patient has completed 5 years of treatment. And for each cancer, the follow up to pick up recurrences is different. Sometimes we do a blood test and we look at tumor markers. Sometimes we do a CT scan or a PET scan, and again the frequency of when and how we do it depends on the type of cancer we have. And again, like I said, there are certain cancers where we know that the risk of recurrence actually goes down if you exercise. So I think whatever type of cancer you have, I cannot stress the importance of exercise more. So I think the main treatments that we have for cancer are chemotherapy, radiotherapy and surgery. And for each of these treatments, you have short-term side effects and you have long-term side effects and you have late effects. So survivorship is actually dealing with all of these side effects. And sorry, what was the question?
What are the health problems that
So the main health problems are related to each type of treatment. So let's say for each of these treatments will have different side effects. So after surgery, say for breast cancer, if all the lymph nodes have been removed from under the arm, there is a possibility of developing swelling of the arm. So we give you certain advice about for that arm. You should not have blood pressure taken from that arm, should not have pinprick, needle stick injuries. And generally after cancer treatment, the healthcare needs may be related to the heart, the heart health, the bone health and the sexual health. And again, like I said, the long-term consequences of cancer treatment may have an effect on your heart in a small percentage of patients. So we do advise about, we have cardio-oncology clinic which can provide specialized care relating to that. And specifically about bone health, the role of exercise is very important. And again, one of your oncologists will look at specific issues that you may have to deal with. So I think if you are young and if you've developed cancer and have not completed your treatment, fertility issues are very important. For men, sperm cryopreservation is a method that can be used to preserve fertility. This is very important. It should be discussed before you embark on the cancer journey. In most of the cancers, I think we are able to address this. There are certain cancers where we have to start treatment within, I would say, 24 hours of diagnosis, but that is a very rare situation. in most cancers, we should be able to address fertility concerns. For men, like I said, it's sperm cryopreservation which can be done. For women, I think of childbearing age, again fertility needs should be addressed with your oncologist and the gynecologist in conjunction. And there are various methods that can be recommended by your oncologist, which may relate to preservation of oocytes or that's the eggs, or embryo cryopreservation.